So talking about liquid embolics has it always been something that's a part of your practice, something relatively new? Just give us some historical perspective on like when you guys started using it, and then we'll start talking about the reasons why you like it or don't.
Sure, I would say years back we dabbled in glue, and it was probably been about 5 years where we got some off-label education on the use of onyx from our neuroendovascular people who work closely with the product, and we thought there was a use case to be made for the periphery. And so we were trained by our colleagues here at the medical center to use onyx off-label. And we were very happy with how it performed. And then lava, which is the most recently peripherally approved liquid A agent, went on trial, and we were a trial site for the lava trial. And we were very successful with that endeavor, and we enrolled a lot of patients. And once it became peripherally approved last October, we really have instituted very quickly as a regular part of our practice.
Okay. If I just wanted to widen the lens a little bit and talk about embolics in general, like what are the broad categories of choices? And then what I really want to focus on for liquid embolics is why you like liquid as opposed to coil or beads, or for what applications. All right.
So one of the things that I think supersedes all of the forthcoming conversation is that we're so fortunate now to have all these tools available to us, because I think there's a use case to be made for everything that's out there. And by having all these options available, we can really personalize the decisions that we make for a given patient with a particular problem in a particular vascular bed. So it's great to have all these options available to us. I think generally speaking, I look at where my target is relative to where my catheter is. And so if I'm looking at embolizing a vascular bed that is of some distance away from the catheter, then I typically would use particles there, or even a less viscous liquid to accomplish that goal. If I'm very close to where the tip of my catheter is relative to the target, then I would use either a more viscous liquid or coils or plugs or more of a mechanical agent. But I think it really comes down to where I am relative to the target and the size of the vessel that I'm in.
What are the points or the points that you consider when choosing like a liquid embolic over, well, anything?
I think a lot of it comes down to packing density. This is a very interesting concept that I think all of us as interventionalists are aware of, at least intuitively, but maybe not facile enough to talk about it. And I think ultimately, no matter what stuff we're putting in an artery to embolize it, we want to make sure that artery is sufficiently filled with the embolic material. And for most of the products that we use, it's a combination of embolic material and thrombus that ultimately leads to the vessel occlusion. So I think that when we're dealing with liquids, what's interesting to me is the amount of space we can actually fill within the target vessel bed. So let's take a step back and look at coils, for example. There's some pretty good data out there which talks about a target packing density of around 24% when treating a peripheral or cerebral aneurysm with coil embolization. So in other words, we want to fill 24% of the aneurysm volume with coils, and that would be considered an acceptable embolization to reduce the likelihood of future recanalization. When you really stop to think about it, if you want to just kind of geek out a little bit and look at the volumes of the spaces that we're embolizing and the
Perfect
volume of the
opportunity.
coils, the volume of the coils that we're putting in, the truth is that it's really hard to do that. That it's very difficult to fill 25 or so percent of a target vessel volume with coils. So, and even in the best case scenario, you're probably approaching 30, maybe 40%. But a liquid is different. It completely changes the game here when it comes to embolization. So if you have a catheter, let's say in a pseudoaneurysm, and you want to fill that space, you can fill greater than 90% of that space with a liquid, because it's just filling it without the impediments to putting, let's say, a bunch of coils in there, because the coils have to fit, they have to fold over on each other. There's going to be gaps between the coil loops, and it adds up to more space than we think. We don't have that problem with liquids. So when packing density matters, a liquid is a great choice.